Someday you find that you can see blood on your toothbrush, or when you spit out after brushing, you find blood there. It's time for worry. Your gums are bleeding. The gums are the support system of your teeth. It is the gums that hold your teeth in the mouth and keep them firmly there. So in case it starts bleeding, you can be rest assured that something is definitely wrong. So what should you do? Should you pick up one of the toothpaste that advertise that you should use this for bleeding gums, etc., etc.? I wouldn't advise you to do that. This is a clear indication that you need to visit a dentist. Take an appointment with a dentist and visit him at the time that he calls you, so that you have all the time that you have booked for at your disposal. And you must try to find out really what is wrong with you. So what could really go wrong? Two things can happen. One is that you have deposits that are sitting just below the gums, which are now rubbing against the gums and causing them to bleed. Or it could be a hormonal problem, as in the case of the ladies. So if you discount that, well, the gents won't have it. So the ladies could have it. But all the same, you need to visit a dentist to find out what really it is. Believe me, no toothpaste can stop your gums from bleeding. Because the cause of the bleeding is not just mere lack of brushing. It is because there are deposits just under the gums which are now causing you all the problems. You must take this as a clarion call and stop the bleeding as soon as you can and restore the health of the gums. If you don't do it in good time, then I can assure you that you're heading for serious trouble. Now, I said that to you in just one small sentence. But luckily for us, it doesn't happen so fast. It takes a good bit of time and lots of carelessness on your part to allow that to happen, wherein it progresses from minor bleeding into an area where the gums are now going to be bleeding. They could be suppurating, that is pus coming out, and don't forget that they're going to smell awful so far as your mouth is concerned. This little video here will explain to you what's really happening. This video clip will explain to you how the gum disease progresses. Extreme left is how the normal gum looks like. This white section here is the tooth. This yellow here is the bone. These are the gums. Here is the ligament which holds the tooth inside the bone. Now, in a normal condition, what you really have is you hardly have a 0.5 to maybe just 2 millimeters of a little space over here where the gums attach themselves to the teeth. This is a normal situation, and as gum disease progresses, that is, when deposits take place, what you get is you can see the reddening of the gums over here. That is, these are irritated. Once they are irritated, they swell, or and then they start slight bleeding. They will start over here. If this is not checked at this particular point, then further decay takes place, or further degeneration takes place, and the earlier attachment over here, which is just about 0.5 to 2 millimeters deep, now becomes deeper, because with the addition of deposits over here, it's not expected to hold on to the same level. So it leaves, the gums start leaving the support of the tooth. Here it progresses further. As we come to this area, particular area, you will notice that a lot of degeneration has taken place, and the degeneration is to such an extent that the swelling is there. There will be a lot of bleeding here, and in addition to that, the bone here has been lost. The bone has degenerated, and this bone support is gone. If we don't wake up to this situation, and you can see these deposits coming up here in multitudes, very heavy deposits coming up. As we go along, you will notice that a stage will come wherein the tooth will be devoid of any bony support as such. This you can see here in the last extreme right over here. The tooth has lost all its bone support. The gums are swollen. Now there are pockets here. These are pockets which started with 0.2 to 0.5 to 2 millimeters at one end have now increased to maybe almost about 10 millimeters or 15 millimeters of pockets at this end. Okay. Now, when this happens, the tooth is now held only by the extreme last portion of the tooth is held in the mouth. Now, how do you expect the bone to hold on to this tooth? This tooth at this stage now becomes mobile. It is not going to be firmly set in the mouth. This is how gum disease progresses. Now, I explained it to you in a very short video. This takes a pretty long time, and that means you have enough time to take steps to stop this. The gum disease, when you lose bone here and you lose the gum support over here, it's like cutting off a finger. It never grows back. This bone, which is now degenerated and come to this level here, is not going to grow back no matter what you try on it. So I hope this explains why you should take the bleeding of gums, which started with a very minor situation here at this extreme here. You has little, little bleeding here. You have allowed it to come to this stage, and let me tell you, it is all your fault. You have just been careless. And believe me, no amount of home care is going to take this thing off. You need the services of a dental surgeon in a properly equipped dental clinic to relieve you of all the deposits that have taken place over here, and wish that things stay healthy for you to enjoy your teeth all your life. Now, in this video, I have showed you all the stages of progress of the gum disease as it happens in the mouth. Now, there's one thing which has not been mentioned in the video, is that the gums separate out, and the pockets which are formed, which started at 0.5 or 2 millimeters deep to an area which is now maybe 10 to 15 millimeters deep, they harbor a lot of bacteria. There is bleeding taking place, there is suppuration or pus formation, and believe me, that's the reason why it really smells very, very, very bad. No amount of mouthwash or no amount of toothbrushing is going to help you at this stage. You seriously need to see a dentist and have some procedures done. One of the basic procedures that are carried out is called scaling. Scaling is usually carried out by a very fine instrument, which is an ultrasonic instrument with a flow of water coming in to wash out things as they are removed from the mouth, and that is used just below the gums to find out exactly if that can help you only when you are in the beginning, or then as the disease progresses in the mouth, it will have to be supplemented with a lot many things, including gum surgery. There are procedures wherein the specialist dentist, who is called a periodontist, will open the gums up, clean them all out, and maybe pack that area with a bone replacement, expecting it to take firm hold again. But you need to take steps in the beginning itself. You say a stitch in time saves 9 is a well-known saying, and nowhere except in dentistry that you find that prevention is better than cure. This is a adage which is, everybody mentions about whenever health conditions are discussed. So please take timely intervention and go to see a dentist and get it done. At this point, I like to tell you that we are now a blessed people. There are more than 3 lakh, yes, you heard me right, more than 3 lakh well-qualified dentists who are practicing and are available to give you professional services. Now, you should always try to go when the time is yours. Don't crowd or overcrowd a dental clinic, because there are enough dentists around, and there's no need that you should go and sit in line somewhere. People generally feel that, oh, there's a big line there, so I'm going to get very good treatment. I'm sorry, you could be thinking wrong. It's not logical thinking. I will give you a reason for it. Number one, whenever there is too much traffic in a dental clinic, what is compromised or can be compromised is the hygiene in the dental clinic, and you could pick up an infection there without even knowing it. Like cross infection, for example, right? And especially now in the times of COVID infection, which is going to last with you, will stay with us for a long time, it is advisable not to visit very crowded places, which you will be compromising on social distancing, and that may really hurt you. So please look after that, and remember, go to a qualified dentist. The qualifications for a dentist is a BDS, the Bachelor of Dental Surgery, or an MDS, that is Master of Dental Surgery. It's in your interest to go to the right person and get your work done. Remember, you will be paying for it, so get the best that you can for the payments that you make. Thank you for listening. If you find my presentations interesting, please take the trouble to like them, share them, and do subscribe to this channel so that you are informed of the next presentation whenever it comes. Thank you.